The DSM-5 criteria for diagnosing schizoaffective disorder is going to include major depressive or manic episode that is concurrent with symptoms of schizophrenia. The key to the diagnosis of schizoaffective disorder is going to be this lifetime history of delusions or hallucinations for at least 2 weeks in the absence of major depressive or manic episode. So, without any mood episodes like major depression or manic episode, patients are still going to experience delusions or hallucinations. This is going to be the key because it can distinguish schizoaffective disorder from major depressive or bipolar disorder with psychotic features. In major depressive or bipolar disorder with psychotic features, the delusions and the hallucinations are going to occur exclusively during the mood episodes. So while the patient is going through major depression or mania, they're going to be experiencing the psychotic symptoms. But without the mood episodes like the depression and the mania, the patient will not experience any psychotic symptoms. Now, with schizophrenia is not going to have any mood episodes that can be diagnosed as major depression or mania. So the diagnosis of schizophrenia is not going to include major depression or mania. So this is how we can distinguish schizoaffective disorder from schizophrenia as well as major depressive or bipolar disorder with psychotic features. Now, here is a presentation of a patient with this schizoaffective disorder. A 30-year-old man is hospitalized after neighbors called the police to report that he has been singing loudly and playing the piano nonstop all day and night for the last month. The patient says his mood is terrific, claims he is related to the president, and hears voices telling him he is going to be a famous entertainer. While in the hospital, he makes inappropriate sexual advances towards some of the female nurses. He has a history of 9 psychiatric hospitalizations starting at age 22 for mood and psychotic symptoms. In between hospitalizations, the patient has heard voices commenting on his appearance and has believed that secret cameras have been monitoring him, but he has had no mood symptoms. Which of the following is the most likely diagnosis in this patient? So, the key that is going to be the determining factor for diagnosing schizoaffective disorder is going to be this sentence. In between hospitalizations, the patient has heard voices commenting on his appearance and has believed that secret cameras have been monitoring him, but he has had no mood symptoms. So, without having any mood symptoms like major depressive disorder or manic episode, he still has had hallucinations and delusions. So, as a result, this is going to be a diagnosis for schizoaffective disorder. It's not going to be bipolar disorder with psychotic features because he is having psychotic features without the mood episode. So, with bipolar disorder with psychotic features, we would expect the psychotic features to happen while the patient is in mania. With schizophrenia, it's not going to be schizophrenia because the diagnosis of schizophrenia is not going to include any major mood episodes like major depressive or manic episodes.